Hey guys, this is Dr. Moore with Cumberland Chiropractic and Sports Medicine. I've got another cool case for you this week. This was a patient who came into us with low back pain that ran down into his right leg. He'd had it for many years, but 2 years ago he had a spinal surgery. The entire lower part of his spine has been fused together with surgical rods and screws. And most people, after hearing that, would say, chiropractic can't help this patient. His segments are fused together. But I'm going to tell you why we were able to help him in this week's Case of the Week. Okay, so this is a still image from a CT study that was done following that patient's surgery. These are the vertebra of the low back there, and you can see the 1, 2, 3, 4, and the silhouette here of a 5th surgical screw that was put in. And this is a metal bar that runs between the heads of those screws and keeps all of these segments from moving. So you might be wondering, how are you going to help this patient with his low back pain? You're a chiropractor, you work with joints a lot, and these joints, they're not going to be moving anytime soon. You can't even move the low back there. And you'd be right in thinking that we're not going to be doing any adjusting in this area. That wouldn't be fruitful for anyone. However, our hands are not completely tied when trying to help this patient. We got to doing an examination, and we find that he has a lot of tension running down that right leg, kind of along the same pattern that he feels that radiating pain down into. It's primarily in his hamstrings and his hip rotators. He's also got a lot of bunched up fascia tissue here over where the surgery took place. So I set to work in loosening up those hamstrings, loosening up those hip rotators, and doing some fascial work over that surgical scarring. We're 4 visits into his treatment plan, and he's telling us he's about 50% improved at this point, and he took great pleasure in telling me that's way more results than he thought that he would get here. He honestly came because he'd tried everywhere else, tried everything else, and he wasn't getting any relief, and his insurance company was going to foot the bill here for him to come see us. So he's really happy with us. His treatment is ongoing, but I have very high hopes for him. I know he's going to do great. Okay, so this week's case was pretty tough. Following that surgery, with the fusion in the low back, we couldn't rely on a lot of the same tools that most chiropractors would use to treat that low back pain. But luckily, our tool bag is pretty deep in that regard, and we were able to help our patient with some soft tissue work down that right leg and over the spot where he had that surgery. If you have a tough case, maybe it's post-surgery, maybe it's not, give us a call. We'd really love to help you with it. If you like this video, please like it. If you know someone who needs to see it, please share it with them. And if you have any comments or questions, please leave them down below the video. We encourage discussion. So, with all that being said, this is Dr. Moore with Cumberland Chiropractic and Sports Medicine, where we're here to get you better faster.